70-year-old male reports with a loose bridge in the lower left quadrant. Now, he's got a dentist. He's been to his dentist recently. He had some work done in the upper anterior region. And when he came in with the bridge loose on the lower left, we asked him why. He said, well, he just didn't feel like he was getting an answer to all of his problems, and things seemed to be adding up. So we said we'd like to take an X-ray. He told us that he just had one taken recently, and in fact, he brought it with him. We told him we would like to get some more information, a little more detail. So we took this film of cone beam at no charge. But first, we evaluated his scenario. This is a picture, frontal view, showing his occlusal table. You can see the bridge in the lower left with some broken porcelain. We then took a picture of the lower left, and again, there's that bridge that's not in very good shape, and it is loose. And most dentists would tend to focus in just that area. Well, we also evaluated the panoramic, and we looked for any sign of pathology, any sign of a problem. We couldn't see anything. I've run this panoramic by several dentists who, upon looking again, came up with absolutely no unusual or clinical finding of any significant degree. What happened, though, is about 9 months, the cone beam was, the panoramic was a year old, but what happened is about 9 months ago, the patient broke a crown on number 9. At that time, the dentist deemed the tooth non-restorable, so he extracted number 9 and placed a graft. He then proceeded to do a 3-unit bridge from 8 to 10. Now, I know we can all see a darkness right up in here. That's the nasopalatine foramen. We can see the graft material that was placed here. Other than that, I see the nasal floor up in here, but I don't see anything else. So we took a cone beam on him as well. And what we noticed was an area of pathology. Now, this area of pathology might have been related to the 2 teeth that one was extracted, one's still there, that had endodontics done, but we couldn't find any relationship. So we took different images with the cone beam, and where number 8 exists, there's no relationship to the pathology. Where the graft is on number 9, there's again no relationship to the pathology. The pathology is in between 8 and 9, and it is not associated with the nasopalatine canal because there's a definite bony wall between. So we now have a non-tooth related pathology, and we're not certain what it is. We did a surgery, we removed the cyst, and we sent it off for biopsy. And it was sent back to us identified as a keratocyst. Now, I learned about this in pathology class many years ago, but I haven't seen a lot of these. And yet the patient was more concerned about the cyst he had than about the bridge that was failing in the lower left. So he was very concerned, and when we got the pathology report back, we were able to identify it for him and explain the probable fact that we cleaned it out and solved it, but it may come back, so we're going to keep watching the area. It's just interesting that we found something in an area we couldn't see and nobody had noticed, and it had probably been there for quite a while because it was quite a large cyst.